Good evening, everyone. Huge warm welcome to all the doctors who've joined us. I hope I'm audible. Yes. So we've just started with some poll questions. I would like to first, extend a hearty welcome to all our panelists today, especially Vikal Sani, who is our CEO and founder at Eka Care and ex Go Ibibo, and he's a volunteer architect at Arogya Setu. We have Mohit Rajpal, who is our sales head, and Anushil, who's one of our director of engineering and a developer, and Dr. Neelesh sir, Dr. Bharat sir, and I think Dr. Nishant sir will be joining us in some time. We'll start the webinar without any delay. First, like I introduced, we have Vikalp with us. Thank you, Vikalp, for taking out your time. He is whatever vision of Eka comes from him. So we wanted to start the webinar and with some of his words and thoughts around this topic. So, sir, Vikalp, over to you. I think we'll not delay anymore.
Thank you so much, Dr. Sanjana. And I think I feel quite exhilarated with so many doctors. And not only that, I'm nervous as well. I always keep saying that doctors are in that Maslow's hierarchy, the topmost human beings sort of a thing, right? And I keep telling that in my class also all the toppers were doctors. The next ones were all engineers. And I was the engineer one, so always I used to envy that how can I be so smart. So that's what it is going on in my mind, being very nervous. But just to start off, again, after thanking all the doctors to be here and the organizers, I would like to quickly tell about how we ended up here. We were technologists and partnered with doctors such as Dr. Nilesh, Dr. Sanjana, wanted to solve for a very simple need that the human, the profile of a individual, which is us, or a longitudinal medical profile of an individual should be digitized. And when we started, we were part of Go Ibibo's team. We quit Go Ibibo and then started building Arogya Setu. That gave us this insight that how important it is. And post that insight, what we realized that most important person who can add value to this longitudinal history of patient are doctors. And during that time itself, I realized that government also is pushing a lot on their Ayushman Bharat digital mission, which again also relays on the same philosophy and vision that like you have your shopping profile on Amazon, or you have your personal and network profile on Facebook and Instagram and so on and so forth. The most fundamental and important thing is about your body, your health. Where is it? And that resonated so well with us as a technologist. And we said that let's start building for that profile, starting with our doctors. And that's how the whole story started. And today, I'm going to take you all through the two key pillars of our product and how we are growing that. One definitely is the working with ABDM and the DHIS incentive, which eventually would boost revenues. It's not only about medical profile, but also revenues for doctors. And second is how we are thinking of our EMR solving for holistic healthcare need. Again, going back to the same promise of solving for end-to-end health, but in turn, making revenue for all the constituents as well. So I'll quickly share my screen. Let me know if it's visible. There's a small deck that takes us through that journey.
Yeah, it's visible.
Yeah. So we started in June 2021. I think the fastest growing health tech platform. We have two products. One is our PHR app, where users are creating their ABHA IDs and so on and so forth. But more importantly, that we want to talk about is our EMR, which is an electronic medical record system for you all. What we see is a UPI moment that is happening in our country on health. Like the way UPI has ended up creating a very different kind of a level playing field for fintech ecosystem, e-commerce, etc. And actually, it was a step change. We have never seen online payments using credit card like it happened in other geographies. We have evolved that to a straightaway mobile payments. And that is what is going to happen on health as well. And that's what we believe is being driven by the unified health interface and what NHA is working on as a mission. But I just want to give a view on why this is important and what this change means to all of us as we participate in this ecosystem. What ABDM is saying is, let's build ABHA as a global UHID. What that mean? Today, when we run our clinics or when we operate out of a hospital or a nursing home, etc., we associate a unique identifier to the patient so that we can create a longitudinal record for that patient. But when that same patient goes to some other clinic or some other doctor or some other hospital, a new UHID gets generated for that particular clinic, and there is no linkages between them. What ABHA is trying to solve on the consumer side is, if I visit Dr. Nilesh and I give Dr. Nilesh my ABHA ID, which is Vikalp@ABDM, and Dr. Nilesh creates a prescription for Vikalp@ABDM. And when I then go to Dr. Sanjana for some other needs, and again, if I share the same ABHA ID, like the way we do with UPI, the global UHID will remain same across the clinics or across the hospital, so that the longitudinal health journey not only is created for that unique user, but it also can be shared and consents can be provided for that particular medical record. That's one part of the story. But ID alone cannot give the medical information, which is the second step that all healthcare providers and all the digital solution provider like us are responsible for, is linking of the medical data with that ABHA ID. So this is a two-step process. Once I created an ABHA ID at Dr. Nilesh's clinic, Dr. Nilesh creates a prescription for myself, and then that prescription gets associated with that ABHA ID. Now, when I go to Dr. Sanjana's clinic, Dr. Sanjana, because I have shared the same ABHA ID, can raise a digital request that please share this medical record with me. If a user gives a consent to share that medical record which was generated at Dr. Nilesh's clinic can be shared to Dr. Sanjana. Today, how that happens is, we have a physical printouts, or we have a photograph or WhatsApp messages that we basically show. So these are very simple two-step process that government is trying to push for to digitize the healthcare. And that is where the DHIS scheme comes in. When and I was at GoIBibo when we were doing UPI. When UPI, the government wanted to adopt, they have actually created a lot of incentive schemes around that. For example, we as a merchants, we were waived off of MDR charges. That when a transaction happens, you don't have to pay any charges, while we had to pay charges for credit card transaction, so that we boost UPI. And government was taking care of all of those charges because someone has to pay for that. Similarly, what government is saying, that generation of ABHA ID and linking of record is a costly proposition to start off with, in the sense that you might have to end up incurring some cost of training your staff. You have to incur a cost of using a software that is DHIS/ABDM compliant, and so on and so forth. So what government has come out with is a digital incentive scheme, which is it's a pretty large corpus, and it has been continuing since last 1 year, where they are saying that for every prescription or every document that you have been linking for a particular patient, there will be a 20 rupees. Now, this is not exactly for a prescription, for any kind of a medical record that you are generating. Example, if your staff is taking a vital, that vital can be linked as a medical record to the ABDM's care context, which would mean 20 rupees. A prescription would mean 20 rupees. If there's a medical history or a medical record that is getting uploaded by your patient, that can also be linked and so forth. For every single care context that we generate at a doctor's clinic, doctors will get 20 rupees as an incentive there. And what happens then is all of this, all of these records that a DSC, which a digital solutions company is linking, they will get 5 rupees for that. This is running and this is well positioned. Just to give you some sense on this, there is an ABDM dashboard that all of us can go through. Government has been fully transparent on this. I'll quickly share this dashboard to you all. If you look at this dashboard, this is publicly available URL. In this publicly available URL, you can see how the linking of records is happening. For example, this is the linking of record by a DSC. DSC is Digital Solutions Company. If I sort it for the month of January, you can see that we are one of the largest linker of the records, largest participant in the whole ecosystem. Similarly, if you go ahead and see on the healthcare provider side, when you look at on healthcare provider side, you would see that there are lots of healthcare provider who are linking already in 10 days, more than 27,000 records, be it AIMS, New Delhi or Bhopal and so forth. And this is a dashboard that is visible for everyone. But not only this, it's so transparent that we can download the Excel sheet from here and we can look at the detail of how this is happening. I think Dr. Sanjana, there's some raised hands, but we have to take questions later, right?
Yes, yes,
Okay.
Vikas. So
Okay.
to all the
Okay.
participants,
So,
we
sir,
will
we will take
get all your questions. We'll take the Q&A at the end of each session, and whichever is relevant, if Vikalp can answer it, he will answer it, and that's how it'll go.
Sure.
Yeah.
So just to give you some sense of that as well, so I've downloaded the sheet and I was just looking at, there are more than 300 plus doctors who are part of the whole DHIS scheme, earning incentives through us as Eka Care DSC. We are again one of the largest in the digital solutions provider. And there are some of the doctors that we were also talking about are doing really well. Where the record linking is upwards of 5,000 already, which is Dr. Luna's Hospital or Mittal Nursing Home and etc. So there's a lot of work already being done here, and something that we definitely feel all of us should participate in the healthcare provider side. Going back to I mean, this is something that the team will also talk in detail about how all of us can participate. But let's go back to something which is even more granular, that we have. ABDM obviously is a digital mission that have recently started. But look at the way we solve for health in today's ecosystem. A holistic healthcare delivery is a part of multiple of these pillars, be it doctor consultation, medicine, lab, or a patient/disease management. When a Dr. Nilesh gives me a prescription, it starts from that prescription. I go ahead, I upload that prescription to 1mg or any other partner. Then I search for the medicines. Those medicines get delivered to my home. Then I look at the prescription. If it's a digital prescription, I again then upload that to any of the lab fulfiller that I want as a user. And then I search for that and so forth. If I look at all of this from a patient perspective, it's not an experience that is absolutely optimal. So I was in the US for some time and the experience was very different, where a doctor has just written a prescription on their EMR. And then he asked me a very simple question, that tell me the zip code from where you want to pick up your medicine. I gave the zip code and then he mentioned few pharmacies. I said that, okay, Walgreens is where I want to take my medicines from. And the information straight away goes to that pharmacy. I go to that pharmacy, my medicine box is already prepared, and then I just pick it up and pay for my medicine. Now that experience is something that gives a very different sort of a personal touch to the consumer's overall healthcare delivery or the user's overall healthcare delivery. And that is what Eka wants to deliver. So what we have done, dear doctors, is with our EMR, we have integrated medicine delivery partners, lab partners, and adherence of the prescription using our app, where an app is reminding the patient that, hey, you should take a medicine in the morning, in the evening, and so forth. All that put together, we deliver this holistic healthcare experience. While we deliver this holistic healthcare experience, we see that all of these providers have a business model also running. And we work with doctors to make sure that this business model of pharma delivery, lab fulfillment, all of that eventually adds to the revenue buckets of the clinic, so that these kind of these revenue can actually solve for all kinds of clinic needs, be it staff needs, be it anything. But more importantly, we want to make sure that the customer who is coming to your clinic is now having an experience where he just gets the prescription. He just not only get the prescription, but the medicines also delivered at home. The flebo also is coming to the home to pick up right from there itself. So it's a hassle-free experience. And while doing that hassle-free experience, because there is a business model associated, there can be a revenue generation capability. If you look at it, the way this works at Eka, after doing the entire prescription creation on the tool, there is an option. And again, we call ourselves, and we are a more tech company. We are not a healthcare provider. Our idea is to build systems that can integrate with all kinds of healthcare partners, including doctors, including lab companies, pharma companies, and so forth, and facilitate the transaction seamlessly. And that is what happens in Health Exchange at Eka Care. A doctor can write a prescription with lipid profile and vitamin B2, B12 as a test. Straight away, these tests can be booked right from the tool itself. Again, multiple options are there, whether you want to book from Metropolis, Redcliffe, and so forth. A similar experience is built for medicines as well. If you want to offer certain discount as per the business model that has been established, you can do that as well for your patients. You can either write your patient's address on the tool itself that your staff can do, and then straight away the booking is made, or you can simply say that, send a message to the patient, and he can do the entire transaction on their patient app. And to this experience, in many cases, truly have changed the way patients are looking at how a holistic healthcare delivery is happening in this particular clinic. That it's not about just getting a consultation, but my end-to-end journey of solution will be taken care of. And to do all of this, and this is all we basically do for you, not only to earn revenue, but to also give a great experience. And last but not the least, to do all of this, we charge for our EMR tool, and that's our bread and butter, because we, being a tech company, has to build products that can solve for your users' need and for your needs. And we offer our plans that eventually will take care of all of these integration, development, and the activities on top of it that we do. So I just wanted to quickly talk about these things, and over to the team for more detailed conversation on how we can do and take any questions that we have. Yeah. Thank you so much.
Thank you, Vikalp. I think you gave a perfect overview of what we will be highlighting on in this webinar today. Just around the two main things. I think we'll take questions first if we have directly. We have Dr. Ganesh who has been raising their hand. Sir, can you post your question in the chat? And just an add-on, so following this talk, we'll have Anushil from our team who will be creating a live demo of how we can integrate, sign you up for the DHIS scheme almost within 5 minutes. So if anyone wants any volunteers for it, please share your We'll just need your Aadhaar number and mobile number for it. We don't want you to share it on a public platform. So you can, we have shared the phone number and the email ID for where you can share it. We'll do one thing, we'll keep the Q&A towards the end. Just to all the participants, please post your questions in the Q&A section of the webinar. We will take all of those at the end of the webinar. Thank you again, Vikalp. I think you've shared the two core strategies what we wanted to discuss in this webinar. Mainly it is about how we can increase revenue. Since we doctors are so focused on our clinical practice, it helps to know some small things which can add on to our revenue streams. So first we'll start we'll now move to our next talk by Dr. Nishant. He's our external guest doctor who's been very kind to join us today. Thank you, sir, for coming and joining us for this webinar. Just a small introduction about Sir. Sir has been a neonatologist with over 12 years of experience from Sonipat. He's also a gold medalist in pediatrics and been one of our forerunners in adapting and untapping the potential of the DHIS scheme. And sir, like we would really like to know about, I know you've had a lot of challenges and the pluses. I would love to, hear your experience with adapting to DHIS. And just we have for all the doctors who have joined us today. Over to you, sir.
Thank you, Dr. Sanjana. And good afternoon, ladies and gentlemen. So through this meeting, I am getting to meet a lot of, look at faces of a lot of people who are working with Eka Care. But I've been in constant touch with them through the phone, and their response time has been exemplarily low. So I've been using Eka Care for 5 months now. So what I'm right now using is the DHIS scheme, and it is truly an honor to be here with you all today to discuss the topic that holds immense importance and significance in healthcare, that is the DHIS scheme. And Eka Care has been a part of this, so they introduced me to this scheme. And over the past 4 to 5 months, I've been doing almost 4 to 5 thousand uploads a month, and as Vikalp was telling that the bread and butter of Eka Care is through our enrollments, I also think that a part of this incentive scheme is also for Eka Care, and they have mastered that very well. So I've witnessed the dynamic evolution of digital health solutions, and I'm excited to share my insights with you all. And being somebody who's in core clinical practice, you find it difficult to find out time to spend extra time to do this. So Eka Care has kind of clubbed it. So you examine your patient and you produce a prescription, and that automatically gets uploaded. And one of the key components of my journey has been through the utilization of their EMR tool, which I am now going to use probably in the subsequent months. And the services and tools have significantly contributed to the efficiency. Patient care is paramount. So the point I want to bring about is doing this extra effort does not compromise the patient care, because on the part of doctor or the caretaking team, there's not a lot of extra effort that we have to do. And somehow we are also supporting the government's initiative of digital health. And I don't think it is going to come into significant action in the next few years, but probably by the end of this decade, a lot of healthcare will be digitalized. Now that government is also digitalizing all the deliveries and then vaccinations, so most of it will be digitalized. And I cannot even think of the horizons where digital tools have access to all the reports and they can point out to graphs. There is one smart report feature that I found with Eka Care that is very useful, where if I upload suppose CBCs of the same patient on 5 different occasions, they give you a very systematic graph showing that hemoglobin, okay, now this time the hemoglobin during this part it was falling, TLC is increasing. So they tabulate all that. And I had to do a certain bit of hard work to get to this talk today. But I just because my whole concept of healthcare has changed with Eka Care. I try to come and give my points, and I would be genuinely happy to answer your questions related to what you might have regarding DHIS or Eka Care. Thank you.
Thank you, sir. I think you really were able to take out your time at your peak hours. I'm really grateful. Rahul, we have Dr. Srinivas and Dr. Ganesh who have raised their hands. If they have any questions,
Yeah, let me.
can you just and Dr. B. Jagdish. I think there are a lot of questions in DHIS. We have, after Sir's talk, Anushil will be going into a little more details around DHIS, so that would hopefully clarify. Dr. Srinivas, sir, I think you can now interact. You're on mute.
Hello.
Hello. Yes, sir, you're audible.
Yeah, madam. This regarding this DHIS, I have been trying to register for this one from past several days, but somehow I'm getting some error while trying to register. I brought it to your team's notice, and they also tried, but couldn't sort it out. So what else should I do it about it?
Yeah. So I'll take this up. What is happening in few of the doctor cases is they are already registered in the NHA website as a zonal head, and that is why it is not getting linked to HFR. And we are in touch with NHA. NHA has acknowledged that it is something which they need to fix. And as soon as that gets fixed, we will change the permission as zonal head to health practitioner, and then we will be able to link it. So it is something which was done previously on the website. So that is why few of the doctors are facing the issue. We are on top of that already. We'll let you know as soon as we get a solution from NHA.
Okay, thank you.
Yeah.
Thank you, sir. We'll take one more question before Anushil takes up. Dr. B. Jagdish, sir. Rahul, can you permit them to talk? Yeah.
Yeah. Hi, good afternoon.
Good afternoon,
So
sir.
actually, I have been using Eka Care, but I am unsure, like no document up. Hello, am I audible?
Yes, sir. You went on mute for a second there. Can you just repeat if you don't mind?
Yeah. So actually, I am uploading documents. So what actually, how does it count document? It is only prescription and other like reports or anything else. And secondly, do they count if the AVA ID is not filled up? Then do they count the document or not?
So maybe I'll take that up. Sir, every single document is one piece of information. So let's say you create a prescription, that is one document. When you upload, let's say, a medical report that you have asked patient to do it, that's another document. If you create a medical history, then it's another document. And that is how the document linking to the care context happens. What is very important in this case, and that's what I tried to allude in my presentation as well, ABHA ID is mandatory because the linking of record can only happen to a patient. And that patient must have an ABHA ID, which is a mandatory requirement for linking. And that is what, when we speak to NHA, they say that maybe initially the adoption will be low, so creation of ABHA ID will take a lot of effort, and the incentives are around that the way to invest, let's say, in an extra staff or whatever it is to create a ABHA ID. So that's a mandatory requirement for linking.
So only thing like after having the ABHA ID only the documents will be counted.
Yes, sir. Yes, absolutely.
And let's say we create the ABHA ID after few visits. So what about the documents already uploaded? Will they be counted or not?
Yeah. So what we do at Eka, sir, we try to, and we take that consent from you. If as a doctor you give the consent, if an ABHA is created later, we try to link those documents so that you can get the incentive for the previously created documents as well. And at Eka, our prerogative is to do everything possible so that the incentives are properly being taken care of.
And one more thing, like, when we try to create the ABA through the mobile app, it is actually not, the OTP is not sent, right? So only when I think we operate through laptop, then only it is showing the option.
Sir, that might be an intermittent issue of OTP at some of the, either at some of the providers or with NHA. We have actually seen this quite a lot in early part of our ABHA journey, when we are only creating ABHA accounts on Eka app. So that could be, sir, but we will definitely look more at it. There is no difference between our web offering and our mobile offering. The OTP would be triggered by the government servers itself. If you look at it, all the OTPs for creation of Health ID, they have NHA as the so we don't control the OTP delivery in that case.
Okay, and what is the thing that minimum 100 documents if we upload, then only we are eligible? Is it so? Or what is the meaning? That is, it is per month, or how it is calculated?
Yes, sir. So it is minimum 100 documents a month. That is how we are actually, to be honest, trying to work with NHA to say that we should rather do the opposite, that first 100 documents should give more incentive. But this is the way the government has drafted the policy. And the documents after that, or any linking of care contacts after that, is eligible for the incentives. But if we are able to change that policy, we actually are pushing that to NHA team. We will be more than happy to raise all of that to you guys.
Okay, and to withdraw the incentive, we have to go to the dashboard, and there we can do that.
Yes, sir. So now they have, so this process was not very streamlined 2 to 3 months ago, but the government has done a lot of work to streamline this entire process, where after registering for the DHIS, and as you will start seeing on the dashboard itself, that this is the number of records that you have linked, you can go to your HFR page and then submit a button to get the money credited. You have to do a little bit of statutory work of sharing certain documents so that the money goes to the right bank account. And that Eka Care team and the success managers that we have for our paid doctors, they will help on setting that up.
Okay. Thank you so much. Actually, I am a paid doctor. I have taken a paid plan.
Yes, sir. Thank you so much, sir. I mean, all of this helps us.
Thank you so much.
Thank you.
Thank you, sir. I think Nishant sir, you wanted to share something? Sorry, laptop. I think just due to shortage of time, we'll just move to the next session, and we'll hopefully address all the questions during our session itself. So Anushil, we take over to you. Anushil is our Director of Engineering, and most of the products that you see on Eka Care tool, he and his team are behind it, and he's one of our SEO specialists as well that we have in house. So Anushil, over to you to give us more details on DHIS.
Sure. Thank you, Dr. Sandhya. Thanks to all the doctors who joined us for this session. Although Vikalp already covered a lot about DHIS, I'll quickly go through some details about DHIS. And then what I'll do is I'll do a live demo how to do a self-registration using Eka, and how to use Eka to get the incentive unlocked for the clinics. Okay. So Vikalp already spoke about DHIS. It's a incentive scheme given by the NHA so that all the doctors can digitize their clinic and be part of the whole mission to make the whole healthcare ecosystem a digital ecosystem, just like how other domains are already digitized. The very important thing we should know is who are eligible. All the health practitioners are eligible for this, and for each patient, they can link 5 records per month, and they will be given incentive for all the records beyond 100. So, for example, if you link 1,000 records, you will get paid for 900 records, because 100 is the threshold. So this is the only criteria which you should know, and each patient can be linked 5 records in a month. It is for each HFR created, or basically each medical clinic or anything. The total incentive is 4 crore. As of now, the scheme is valid till June 2024. It was earlier only till December 23. It got extended to June, and we are hoping that in future it will again get extended as more and more doctors are getting excited to work with government on this. There are a few important parts that why doctors should be part of DHIS. One is, of course, that we need to make this whole healthcare ecosystem digitize and make it more streamlined, and help government to make it as similar or even better than just how UPI system is working for fintechs. Another is you can earn incentive, which can help you get your clinic digitized and subsidize your cost of maintaining clinic or staff or whatever. So this will, or even you can use this money for marketing if you want. And of course, all the government policy changes, right? If you want to be aware of and be ready with whatever policy changes are coming up, it is important to be part of DHIS and ABDM, because that is something which is the future of healthcare. There are many benefits that Vikalp already talked about, so I'll just skip this slide for now. Let's quickly talk about what Eka offers as a product. We are a ABHA first EMR. We take ABHA and ABDM as a mission, both in our PHR app as well as in our doctor tool. And we do everything possible to make sure that ABDM gets successful, and all the doctors who are part of this get successful as well. So very first thing, the registration is just 1 minute task, which can be done on the tool. You can click here in the ABHA section and do the registration. I'll do a live demo as well. And on app also, you can just do it right away just by giving 2 OTPs, one against your Aadhaar and one against the mobile number. Another thing is what we have done is we have customized our patient directory to make sure that you know against each patient how many documents are already linked, for which patient ABHA is not created. So everything is very straightforward here, so that even staff can just quickly understand and know what need to be done to make sure that all the documents are getting linked. Similarly, on Q also, we have done all the intervention to know if the documents are getting linked or not, and if ABHA is created or not. And this can be part of staff workflow, and doctors can guide, or our success team can guide the staff to follow the workflow, how to create ABHA and what to do and what not to do. So it is all on the tool, very intuitively designed and well thought product. And we have also launched recently a dashboard where you can see in which month how many records got linked and what which all are eligible. This all is available on the tool itself, and you also see that what are the potential loss, because maybe ABHA was not created for these patients, so document got created but they didn't get linked. So all this is very transparently provided in the tool itself. So I'll quickly jump to the demo. So I have few volunteers already who have reached out to us. Let me just take one of them. So Dr. Arun, we have who have shared his detail. So I'll quickly log into his account. Dr. Arun, you can share the OTP with me on the WhatsApp number itself. And I'll request all the doctors also to, if they have the access to tool, they can quickly do the same process, which will help us expedite this whole registration. And this is available in both app as well as laptop.
So
Thank you, Dr. Arun.
doctors, whoever is on Eka as well can do this simultaneously and only see how we can do it as fast.
Yeah, thanks, Dr. Arun, to share. I'll quickly I'll unshare my screen for 1 minute so that I can put the Aadhaar number. So first step is HPR creation, where basically identity of doctor is taken, and that's why it is Aadhaar first. So I have already put the Aadhaar number and I put the OTP as well. So first step is done. Now I need to put the mobile number linked to this Aadhaar. I have it already. So I just put it. Okay. This is the HPR ID. You can choose one of the HPR ID as per your name or as per your brand. I'll take Arun Kumar as it is. It contains all the name detail, and just click OK. So this first part of registration is done, which is HPR ID creation. Next is registering your clinic. Doctor has already is using Eka, so all the details are already there. If you want to just change this address or anything, you can update it here and then just press submit. Yeah. So now this is completed. The whole registration is completed for doctor. And now you can see that this is green color. That means your tool is now compliant with ABDM, and it is good to go to link all the records you will generate. Let me just either switch to my account because of the doctor's account. I'll quickly show how to just create ABHA for any patient.
Anushil, I think someone, doctor in the chat is asking you to go a little slowly.
Oh, sorry. I'll do one thing.
Can you repeat the steps which you had done?
Yeah, I have a recording also. I'll quickly play that recording. Yeah. So first step is to click here, ABHA, and register now. If you're doing it on app, you will see a first card as register now for ABDM. Once you come to this screen where you need to put the Aadhaar. So we just need to put Aadhaar. That is the first step. Once that is done, a OTP will come to the mobile number linked to the Aadhaar. So that OTP need to be filled. I'll just take 5-second pause. So once OTP is done, you just need to tell the number which is linked with Aadhaar. If you want to register with any other number, you can put other number also, but then you need to put one more OTP. So it's a choice. Most probably, it's better to use the number which is linked to Aadhaar.
So for anyone else who's trying this simultaneously, just keep two of these things handy, your registered mobile number and other number. And I think post that it's like a 3-minute process in general.
Yeah. So this completes the HPR registration, which is Health Professional Registry. So this is the ID, and eventually this ID will be something which can be used by patients or anyone to share records directly or even to search. So that is what the future of ABDM is. So this will become just like how UPI ID is there. This will become a HPR ID for all the health professionals, which can be used for searching or sharing records. And the next part is registering the clinic, which is called HFR registry, Health Facility Registry, which needs clinic name, PIN code, and the full address. So, and that's it. That links the whole, completes the whole registration process. I'll quickly log in to my account. Although it's a demo account, might not work because it's not the actual doctor's account. But I'll just want to give an overview how to start linking. So as soon as you put mobile number, so a OTP will be sent automatically. This is something which you can customize if you want to do it automatically or you want to manually trigger. We have both the options. And this OTP need to be shared by the patient. So it is advisable that once a patient comes to the clinic and when you put the appointment, that is when you should do it. And this is needed only once. Once a patient is registered, for the next visit, this flow is not needed. So this is the only extra step which need to be done by the staff to create the ABA. Everything else, linking and making sure that all the documents which doctors are generating as a part of consultation gets linked to the NHA. So everything else will be taken care by the software itself. So yeah, that's it from my side. I hope I made it a little easy to understand the whole process.
I'd just like to add, we keep conducting these webinars around, DHIS and all other new updates in the whole field right now. So we had a very detailed DHIS webinar last month. We'll be sharing the link for it in the chat as well. We are seeing some questions around DHIS on the Q&A. Anushil, I think one or two we can take before we move to the next.
One question is only prescription considered as document? No, what we do and a medical any kind of medical record can be linked. Even a medical history, if you capture medical history, which is part of the patient form, that can also get linked. Follow-up can be linked. So total 5 document can be linked for one patient in a month. And if everything is digitized in a clinic, what we have seen that in one visit, actually doctors are able to create 5 document because most of the patient comes with some medical record which staff uploads. So all those things actually gets linked. And of course, prescription gets linked. If prescription is not even created, you can, and if you're writing it on a paper, then you can just click a photo and upload it. So that is possible. Even if you take vitals, we have a vital section that will also get linked with the HIPID. What if I have more than one place where I conduct link? So what need to be done in that case is HPR will be one because it's one doctor account, but HFR you need to create 2. That there's a process. You need to do this just 2 times. That is the only thing needed. I'll try to read one more. How can I withdraw my incentive? So this is something which once you have linked more than 100 documents and there's a threshold in when the amount gets dispersed, I guess it's a 1 month, after 1 month, you need to submit few forms and bank details, and we are working with NHA to make it a smooth process. But our success team will definitely help you with the withdrawal of incentive. Okay. Over to you, Dr. Sanna. I guess we are running short of time.
Yeah. So we saw in the poll, some of them have found it challenging to register. So since, we'll finish the next 2 talks and doctors who had a challenge in registering, we'll be happy to stay back and sort it out. We'll do it at the end of the session. But for now, we'll just wrap up and move to our next session. So Vikalp had highlighted on 2 streams which you can explore for increasing the revenue flows in the clinic that we generally run. So we have gone into a certain amount of detailing for DHIS. So before we go to the next one, again, I'd like to thank and welcome Dr. Bharat sir. who has been our external doctor, a champion of digitization, I would say. Sir, can you hear me, sir?
Yes, I'm here. Thank you very much.
Sorry, I think even you have joined us at one of your peak hours of the clinic. But again, a huge thank you for joining us. A little bit about Sir. Sir is of, I would say, national and international acclaim for his practice in sports medicine with over 16 years of clinical practice. He's the founder and director and CEO of two signature clinics in Bangalore, the Zyathlon Sports Medicine and Medifit. And so Sir has both the, essence of a clinical doctor and a bit of businessman in him. And so we would love to hear more about, your experience about using the health exchange flow or what a product or the journey that we have built for all the Eka doctors. I'm sure all of us are waiting for it. Thank you.
Like my journey started off with my bad handwriting.
Okay.
So I didn't want to, I barely could understand my own handwriting when the patient came back with the prescription. So I started to digitize, and then I had to use Google Forms, and Google Document. That's how my digitization journey started. And Eka is like really a blessing. Wherein we can enter everything, and then even if it is like a voice note, basically we just speak to the patient and then keep typing. All you need are good typing skills. That is most essential in today's world. So everything, and then I'm sure they're coming up with other, departments like nutrition, and then exercise also is being integrated, and then smart devices also are being integrated in what I've heard. So this definitely adds a lot of value to us as doctors, wherein we need a lot of other data other than what the patient tells you and the history, and also what examination that we do. And the best ever thing is the health exchange is basically wherein we don't have to rely on a phone call to the lab, and then you can just create a package within your own clinic ID, and then you can add whatever test you want, and then you just have to click a button that say monetize, and it basically goes on, and then even the medicines are home delivered to the patient. It is so much more easier to track. And of course, not all medications and all supplements are not there. I'm sure they are added very soon. But it's never been easier for us to focus on what we really do best. Instead of hiring a new staff or another staff to manage the diagnostics, I initially, when I built my clinic, I thought, okay, I will have a phlebotomist inside of my clinic, and then I'll have a mini lab inside the clinic. But then the room is still lying vacant, where I have a room for the lab, but then there is no phlebotomist, there is no lab. I don't really need it right now. So that's how easy life has been. So this is in short about my journey. So I totally love Eka Care, and then I'm sure I'm using it the most, because 5 of my team members are on Eka. So we have consultations every week. We run a lot of healthcare programs. So every day we log into Eka like 3 times.
Wow.
So that's how Eka has changed our life.
Thank you so much for such a kind word, sir. It's deeply motivating for me personally as well.
No, truly, I'm a very tech-savvy doctor. So unlike most doctors, of course, so I've been searching for apps or tech-based devices to integrate. So I use a lot of heart rate variability monitors and sleep monitors and smartwatches and all of those things into my practice. So being into sports, okay, so tracking all the data becomes very, very vital for us to change an athlete's performance. So, and of course, coming back to metabolic health, lab tests are just not enough. So we definitely need the tech, and then I think that's how we evolve as healthcare practitioners. So that's how I see it forward. You guys are doing a great job.
Thank you. Thank you so much.
Thank you so much, sir. Really, like I mentioned, sir is one of those champions of tech who has integrated so many flows in Health Exchange. I think Mohit can get a little go deeper into it when he's talking about it. But thank you for taking out your time. If there are any questions, okay. I think people are still in. So then I think because DHIS is still a known scheme, Health Exchange people need to understand what it is. So Mohit, sir, over to you to explain what Health Exchange is, and I think then we'll have more questions to understand what it is.
Thank you, Dr. Sanjana.
Thanks again. Yeah, Dr. Bharat, sir. Yeah, please over to you.
Thank you, Dr. Bharat. I think it's equally pleasure for me to hear about this. Thank you so much for this. And thank you, Dr. Sanjana, for giving me an opportunity. And again, it's a pleasure to demonstrate HXNG in front of many doctors. So thank you. I'll just divide this session in two parts, a small presentation, and then second, we will do a live demo that how Health Exchange doctors can do an order, right? So I'll share my screen. I hope my screen is visible. So before starting and telling that what is Smart Clinic Initiative, I would just hold on and just tell that, what Eka brings for doctors, right? So Eka is a clinic management, e-commerce enabled clinic management platform, which enables doctors to, write digital RX, manage their appointment, and also from the same platform, they can basically they can tap an opportunity for labs and pharmacy and make their clinic as smart, right? How the clinics are becoming smart, I think we will just proceed. So under the Smart Clinic Initiative, a respective doctor can earn an opportunity to unlock an opportunity to earn 5 lakh per year, right? And we also have a couple of USPs here, like for doctor to to launch medicines. So it's just a click of a button. Doctor can activate lab from our ecosystem. So under medicine, what we offer a network of 50,000 pharmacies across India, and we ensure that yes, there is a right delivery of medicine happening. And on the other side, we also have a partnership with 1mg. So basically, what we offer here is what you see is what you get, and we ensure that the branded medicines prescribed by the doctors, the patient gets it, right? On the other side, we also have a lab test. So basically, we can activate labs, and we offer a wide range of labs. So basically, under the lab, we offer a choice of selection. So basically, what we have done, we have integrated with all NABL labs. We believe that yes, doctors should not do this at their end because managing labs is again not easy. Why, as a doctor, I have to entertain with 5 lab people, where a technology player can manage this. Similarly, we have an integration with all the NABL labs, which I'll show in my next slide. And what we bring onto the table when doctor activates lab is the transparency, right? So what I activate, I offer a choice of selection for my patient. Second, as a doctor, I'm getting the complete transparency that, okay, if I have 4 patients whom I prescribe the lab test, who has gone to which lab, I can see it. And on the other side, what I get it as a doctor, the report back to my platform, right? So basically, once the report is generated, it comes back to the system and goes to my patient also. And next time when patient comes to me, even if he's not carrying a report, I have it so that I can manage my patient care pretty well. On the other side, like I was saying that for medicine and lab, what we also offer a facilitation fees on every lab order and a pharmacy order. This has been given as per the guidelines, right? So let's say if a doctor is ordering any lab test or any medicine, we pass a facilitation fees. This slide, which while I was telling that the integration of all 4 labs. So what we have ensured that we have all the partners available on a platform, which is we have kept in mind that yes, reliability, affordability, and yes, is maintained. So if we talk about Metropolis, it's known in the market. from last 35 years, and yes, they bring a lot of trust. On the other side, Redcliffe is accessible and affordable, which is again an NABL lab, and Orange is known for their fastest report delivery and experience. And Newburgh again is known for reliability in the market. So basis on this, option, patient can choose which one he wants to go for. So this is what we activate for doctors when they come under HXNG and can make their clinics as smart, right? So I would urge all the doctors, if they want, if you guys, if you want to know more, please share your details in the link shared. Apart from this, what we offer is the in-clinic branding solution for your clinic once you are activated under HXNG. This is what we offer, and I'll definitely move to the live demo, like what are the other values we bring when you actually use Eka Care and do HXNG. I hope my screen is visible. So in screen, I have a patient called Susmita. As a doctor, what I'll do, I'll try to order. This is our prescription pad, right? So as a doctor, what I see it first is the medicine which I'm prescribing. It gives me the thing that what is available and what is not available, right? So let's say I'll write Rentitop PG, right? And I write another medicine also. So if you would have observed on the left-hand side, what I'm getting, I am getting an option that please write a substitute medicine. That's so powerful that as a doctor, the technology is guiding me that medicine which you have written is not available. Generally, what happens when you prescribe a medicine, as a patient, I go to pharmacist and I call the doctor back, hey doctor, this medicine is not available. He's asking me to choose for another medicine. So now, whatever medicines are available, it's a choice. Again, you can give a substitute of this. So let's say if substitute of this is Rwanda, I can do that as a doctor and confirm. So in this, what I am assuring that whatever I'm prescribing, my patient is going to get it. That's again a value, right? So this is what we ensure. On the lab test front, I'll just delete it, all the test, right? So that we do fresh. So under the lab investigations, I'll just, if you see, there are two slides. One is on the left-hand side and another one is on the right-hand side. So left-hand side, again, I am getting an option which one is bookable and which one is not. So how we have designed it so well, the left-hand side one is the routine test and the specialized one. And the right-hand side one is the packages. As a doctor, so let's say if I'm a diabetologist, the top diabetologist packages which are available are being shown on the top, but as a doctor, I can also customize it. Now, if you see, like I write lipid, it's saying that, okay, it's bookable. I write, let's say FT3, it's bookable, and I can do that. And similarly, on the packages front, if you just hover it, it tells me what are the components available in this package, which my patient is going to get it. So in this system, I have a complete transparency. Now, let's say if I say that, okay, finish prescription, I come here. As a doctor, I also have an option to order. Otherwise, the staff available in the clinic can do that. Let's say as a doctor, I end the visit and the patient come to the receptionist to ask for a digital RX. Now, as a staff, what I can do, I can order medicine, I can lab both. So let's say if I order medicine first. So this is the power of technology, right? So whatever I've written, all has come in one cart. It's so easy for a staff that just to place an order. So if you see that medicine which you have prescribed has already come into the cart, it is showing me the total amount. What I have to do it as a staff, I need to just collect an address and place an order. That's it. So since this is my old patient, the address is already saved. So it doesn't mean that if I commit again, you have to add it again and the system will save it. And what staff can do, just place an order by writing that pay on delivery and it's confirmed. So if you see what I see on the screen is, it's a live order, right? It's happening. It also tell me that, okay, estimate delivery 9 a.m. on 14 Jan. So there are medicines, let's say, which are just available immediately available. The orders are getting placed and deliver at 9 p.m. etc. So it depends like which location I choose on. So as a doctor, I'm sitting in Bangalore, I can order for my Indore patient also. Similarly, if you look at the lab test, so while I was showing the value of choice of selection, so the test which I prescribe, it has come into cart already. And as a staff, I'm showing to my patient that, okay, the option is one is with Redcliffe, Newburgh, Orange, and Metropolis. This is so, 1 minute. This is so interesting that, as a patient, when I go to the clinic, which is under Eka, those doctors show me the choice of selection and I can select as per my wish. Doctor doesn't have to say that, okay, go and get it done with X lab. So let's say I select Redcliffe. Again, based on your instruction, let's say if staff passes 20% discount, they just have to select the slot. Let's say I say that, okay, this patient wants 6 to 7 in the morning. I confirm and the lab test is also booked. Again, the payment can be made directly to the lab guy. And the lab test is booked. Yes, it's again, it's a live order and we will be on the thank you screen immediately. Yes, it's done. So it shows that, yes, collection on 13th of January, 6 a.m., the collection will be done. Now, what is the value? The moment the reports are ready, I will also get a notification on doc tool itself. And under this patient, I can go to the medical record and see that, yes, this lab report is available. And while, the ones who are using, they understand the value of this ecosystem. The moment I click, the system also tell me, after reading from this report, like what is good in my health and what is not. So that definitely I can do it. And whatever values I want to copy in my prescription, I can do that. So that's it from my side. Again, the doctors who are part of ecosystem, I would request them to activate Eka Health Exchange by going here, right? And in the setting, you just have to select or activate pharmacy or labs. It doesn't matter whether you have a pharmacy or not. Even if you have a pharmacy, you can activate for those use cases where the repeat order is happening. So for an example, you have prescribed a medicine to your patient for 20 days and it's getting finished. Again, it's a repeat use case because that patient must be buying from the local pharmacies. For a lab test, even if you have a lab, you can do that because the ones who are in your clinic will do the lab test. But what you have asked some patient to go and do it after 7 days. So again, our ecosystem can be used for those. So again, the platform is open for everyone, even if you have a pharmacy or you have lab, or if you don't have, still you can activate our ecosystem. So thank you so much. And I'll just hand it over to Dr. Sanjana and happy to take any questions.
Thank you, Mohit, for I hope making it simple and understandable for all the doctors we have, just how we've built the health exchange flow and how both the patient and the doctor hugely benefits from this. Rahul, I think we have 3 doctors who have raised their hand. I think we can take their questions. Dr. Suresh Ahlawat. Sir, you're on mute. Yeah.
I'm Dr. Suresh Ahlawat. I'm a dentist. I was on your talk for continuously, but dental clinics you are not talking much about, because dental clinics are not having lot of patients. Generating 100 first records will be a problem. Regarding dental clinics, what is your progress?
Yeah.
Will Mohit, can you take this or shall I?
You want Mohit? Yeah.
So thank you, doctor. So ideally, our platform is available for all the doctors. It's not that we don't have dentals who are not using. Definitely, we have dentals also on our platform. But yes, in case if you have any specific suggestions we would be happy to take it on. I'm sure that you have been given a link. If you can put it there, that'll be great. Otherwise, you can go to a platform. There is a section to raise your request, like what do you want. So our product team will evaluate. If it really makes sense, we will definitely take it, because we believe that whatever we do it, it should solve the problem for all the ecosystem, right? Uh, let's say if your request is really meaningful and can solve for a lot of doctors, we will surely take it. So since you are an
Okay.
expert, please share your suggestion there, sir.
Yeah, another thing I want to ask is your Eka care I was going through. Can we directly approach to NHA for DHIS?
Yes, sir.
Yeah.
Yeah, directly also approach.
Yeah.
Directly or to
So there are two parts to it. Registration you can do at the NHA website also. The whole PHR creation and HFR creation both can be done there, HPR and HFR. But to link, right, you need a software, and that is called HPID linking. So that linking also happens there. We have our HPID which you need to put under your profile in NHA. So you can do it there also, or whatever software you want to use, you can put there HIP ID. But all of it we have done in tool to make the experience much smooth and easier. But yeah, you can do it on NHA also. The only thing is you need a software to link the documents. So that is a very basic need for this.
we are already using Precto for last many years. Will that work? Will that work with it?
At least I'm not aware if they are DHIS compliant.
Not yet.
But
Not yet.
not
So
okay.
I'll just add to the points that Mohit and Anushil mentioned. Sir, dental practice is very important in our radar of product promises. So on DHIS, which is what today's discussion is, and on Health Exchange, we solve everything, and we have doctors both on DHIS as well as on Health Exchange who are dentists, and they are running their practice with us. And they have been successful in both of these areas. But there are certain key features. For example, a chart of all your like teeth and everything. I'm not a doctor, so I just fumble, and also I'm nervous. So those are the things that the team is definitely working on. And so is in case of pediatrician, so is in case of endocrinologists. There are multiple such branches that we are going deeper into it. When it comes to the large needs of a dental practice, and I was speaking to one of our doctors who's dentist. He uses us for appointments, be it an online appointment or a walk-in appointment. A very big part of his practice is create multiple services, such as root canal service, all of that. That is again a part of the platform. Billing is completely automated, prescription generation to all kinds of utility, which is Health Exchange and DHIS, is all available. But there are deeper nuances of medically aware dental practice that we are working on.
Oh, that's okay. But I was wondering that if I look on Eka Care, do I have to stop using my previous software? Do I have to go? I have to do double efforts for these both of them. How to go with it?
Sir, you can see many doctors, they have come from various other tools, and we help them migrate from their previous tool to Eka Care. And then we largely recommend doctors to use one tool, because it won't be productive to use two tools for your staff and yourself. We help definitely to migrate patients, migrate other data from other tools that you are using already.
Okay, I got it. Basically, if I want to say use your tool and then DHIS, that will be a better way to do it. But when you were demonstrating, to be very true, मुझे तो कुछ समझ नहीं आया.
Yeah, sir, sorry. Demonstration is sometimes overwhelming as well. But if you are interested, there is a sales team, there's a success team. They will reach out to you to give you an in-person demonstration as well.
Right. That I would like to have. I like to know about it.
Yes, sir. So I think the team here they are taking the note of it, and we'll set something up.
Right. Okay. Thank you.
Thank you, sir.
Thank you, sir. I think we'll take another question from Dr. S.S. Amarnath, sir, has also raised his hand. Rahul, can you just take? Yes. Hello, sir.
Dr. Sanjana, good evening.
Good evening, sir. How are you? Please, you had some questions for us.
Yeah, in fact, see, a couple of things. I know you're talking about the DHIS and integration and all that thing. That's fantastic. Eka, what you're doing is fantastic one. We are just a scratch on the scratch of the surface. We are not even scratch on the surface. We are just a scratch on the scratch. The digitalization of the, what shall I say, healthcare in India. And it is an ocean which the floodgates are not opened yet. It's a huge opportunity for each and every one. We can take it forward. And I look forward to be with Eka and take it forward in a big way. And I wish the team all the best. And I would definitely appreciate if one of your team members can come in. Now,
Yes.
the question, as an individual doctor, how do I go about it? If I were to, see, now you're talking institutions and the lab and all that, fantastic. But if I were to, because other platforms have given me, I'm still consulting 4 to 5 patients a day, and it's been fantastic. Now, how do we go about it? Is this a platform? You can cut short. If you can tell me if it is not a platform, we'll take it forward another day. No challenge.
No, sir, of course. There is no right or wrong platform. Thank you for summing it up. I think those last 2 sentences, I'll let the other panelists take the questions.
No, I'll take it. I think I'm first of all apologies for these experiences, sir. These are exceptions, if I may say. It happens at times. I mean, I'm a technologist. I always want to write a code that has no bug in it. But sometimes, unfortunately, when I ship a product, there are bugs, and then I go and then I fix it, and that's life. And I think we want to be very true to our ethos that we want to give the gold standard experience. But at times we get overwhelmed, and that is what would have happened in your scenario, where we would have not been able to reach out to you. But I'll look into it personally as well, and we'll reach out to you to solve for the issues that you have. And I'm glad after all of this also still you feel that there is a lot that we have to achieve. I don't think you are scratch on a scratch for us. Doctors are the heart of healthcare. I mean, it starts from a doctor, it ends at a doctor. Right from the time when a doctor advises and to the time when a patient goes healthy, hale and hearty. And digital health cannot be driven without the support of doctors. Now, coming back to the question, sir, in all of this, you definitely can participate if there is any specific thing. Example, if it is about the DHIS or health exchange, where do you see that there is a challenge in participation? I mean, I don't see any challenge in you participating in any of the initiatives that we are talking about.
Great. One, to correct your perception, I said scratch on the scratch. I'm talking perception. I mean, sorry for the background. No, I said some construction going on. Now, I said the digital health scenario in India is a scratch on the scratch, I said.
Oh, yes.
Not from the doctor point of view.
Yes.
It is not even a scratch on the surface. It is just a scratch on the scratch.
Absolutely. No, that I totally agree. Yes.
So that's one thing. And two, 4 different hospitals I go to, obviously they have their own EMRs. And I've been having this EMR, I've been associated with EMR for the last 35 years of my life. And I'm very easy. And in fact, to tell you frankly, I present my presentation from my mobile phone for the last 15 years. I create my PPTs from mobile phone. So
Wow.
that's how it is. And the challenge here is obviously integrating the patient, getting the appointments made, and this and that. And I, one point contact sales team, I come there and tell them, in spite of that, there has been some challenge. Okay, let us address that later. So, but definitely, I think coming with ABBA and taking this forward, you guys have done a fantastic work. And then there's a huge amount of work which is, behind me, which is going to be there. And definitely, you can guide us as
Sure.
individual doctors, because the number of doctors practicing outside the clinic and practice, that is massive. It's an untapped market for you guys yet.
Absolutely. Absolutely. And that's what the whole idea of these webinars and reaching out as well. And we present this to a larger audience, and then we go for a one-to-one sessions so that we can get really deep into how this can solve and this can fit into your current practice, because every doctor has a very different nuances of not only practice, but also the way they organize things around them. So that's what is the plan, sir, and that is what we'll do after this webinar.
Fantastic, Vikram. I appreciate, and Happy New Year. All the best. Thank you.
Thank you so much, sir. Thank you. Thanks.
Thank you so much, sir. So we just have one more last, session and talk by our very own Dr. Neelesh, sir. So till now we've heard all non-medical people talk about, what are the experiences around and some external doctors. But now, sir, I just invite Dr. Neelesh, sir. He's one of our founding members, the head of medical affairs at Eka Care. And both the schemes which we have discussed, he has been the forerunners of it at his clinic. So, sir, if you could just tell us some challenges for our other participants as well, as a doctor, what they need to know before taking up any of these initiatives in their clinic.
Yeah, hi everyone. Good evening. I'm Dr. Nilesh Kapoor this side, and I have a dubious distinction of being both a physician and diabetologist, besides being the founding team member of Eka Care. So I would just like to say that if you have ever thought about running your practice without any tension or without any stress, I think this is the platform you need to go for. And the reason for that is twofold. Number one, so when I started my practice, my biggest challenge was how do I manage my clinic appointments? And there was a huge responsibility on the part of my staff. And sadly, my staff was not that sincere, because he was a part-time staff. And the problem with the part-timers is that they just feel that they have a 2-hour job in the morning and 2-hour job in the evening. What happens in between is just a lost cause. So all the calls which used to come to them, they just used to get disappear. So from there, building a practice from, say, from 1 to 2 patients per day to today, 20, 25 patients per day, I think technology has played a big role in setting up my clinic as such. And one of the biggest reasons behind the success has been Eka itself. And we have done all the piloting in my clinic to begin with. And even today, we run all the new features, new partnerships, new things in my clinic just to assess how they go about. And what I have realized is that when we are trying to do multiple things, we doctors have multitasking by default. We have to run to clinics, we have to look at our families, we have to go into the hospitals, look at different cases, sometimes juggle between different hospitals. So it becomes very difficult to kind of manage a lot of caseloads, streamline them, devote adequate time, and at the end of the day, the patient basically they complain that they are not getting the adequate attention that they deserve or they want. I'm just talking about the perception part. Reality might be different. You might be giving a lot of time and you might be thinking that you are doing your best, but sometimes the perception differs. So how do you manage the expectations vis-a-vis the quality of service? So I think from that angle, if we see, two things stand apart again. So when you are using a digital appointment system, the patient has got a knack of booking appointments, especially the people from IT background who are living in metros, booking appointments at 1 a.m. in the night. How do you allow them to do so? How do you even facilitate them doing that? Because it's their part of life. They do it, and they do it out of their own volition, and they feel perfectly all right doing that. So how do we as doctors adopt with the changing times, with the changing adoption of technology among the masses, how do we ensure that we are also on the cusp or the road of this datization? So this technology, which we say is a harbinger of your managing or 360 management of your practice. This enables, first thing is stress-free appointment management system, the clinic management system. Now comes the second part, that is comes the revenue part. So what I had experienced to begin with was I started with a pharma shop of my own. It took me an investment of around 20-25 lakhs. And even then I struggled to kind of get hold of my staff who could run it properly and stop pilferages. I couldn't stop pilferages. At the end of the, say by third year, I shut it down. Then I took to lab, and even in the lab, the problem was how do I ensure quality services? It's not my cup of tea. Who will answer the questions? Who will answer the patient about all the delay in reports? So again, Eka came to the fore, and we are managing it through this third party. So if I talk about as a standalone doctor, all these nuances, all these problems are taken care of by the third party. I'm able to focus on my patient care. From Eka side, I am able to say, or I am able to see a lot of gaps that used to exist between the practice and revenue generation is getting filled by using technology. We have got far more satisfied customers or clients who come for repeat visits. The reminder goes, and they are happy. They are happy. There are patients who like to book their labs and their medicine orders on their mobile app, and they are able to do so because of Eka Care. So I think it's a perfect match between what a doctor wants, a peaceful, cool life, despite having all the challenges in managing patients, and obviously ensuring that our revenue doesn't get minimized because of that. Because if we want to choose a cool life, we should not be minimizing or should not be foregoing our revenue streams. So I think if you want to marry both, we need Eka. So thank you very much.
Thank you so much, sir. I think no one could have summed it up better than you. So we have like really overshot the time. So maybe so that as a thank you to everyone who has joined us and people who have raised their hands and who have posted their questions, we will be reaching out to you personally as well. We have a WhatsApp community. So we have now taken this up as a regular thing where we keep conducting webinars such as these and post content which would be useful for all doctors in general. So please join the WhatsApp community. The link is pasted in the chat box. We'll reshare it. And thank you to all the panelists for staying throughout the extended webinar session and all the participants importantly. We are sorry if we couldn't take any of your questions or answer, but please, everyone who's raised their hand, we will reach out to you personally as well. Or you can stay back in the webinar. We can, some of us will stay back and we will be happy to take your questions. Thank you all.
Thank you, everyone. Thanks a lot. Thanks for joining us.
Thank you, doctors. Thanks a lot.